So my clinical practice comprises both the treatment of patients with transfusion-dependent anemias and bone marrow transplantation. And I suppose there are two different ways according to that as to how to use FerriScan. So if I start first with the patients who have transfusion-dependent anemias and whether they have sickle cell disease, thalassemia, or one of the rare inherited bone marrow failure syndromes like Daman-Brafkan anemia, I do a FerriScan at least on a yearly basis so that I can assess the efficacy of the chelation treatment. If I know, thanks to using the FerriScan or because of other clinical problems or techniques, that the patient is particularly iron loaded, then I might choose to do it more frequently, every 3 or 4 months, in order to assess the efficacy of my treatment and to be able to adjust the chelation treatment. In the transplant setting, we know that iron load affects the outcomes, and it's particularly important if your bone marrow transplants are for transfusion-dependent anemias, for red cell disorders, in which case you have a risk of serious transplant complications like veno-occlusive disease if you go into transplantation with significant iron load and organ damage. So on those patients, I do the FerriScan as part of the assessment of the patient a few months before I go ahead with the technique of transplantation, in order so that there is time to adjust the patient's treatment and achieve the optimal outcome. The age range of using FerriScan becomes very relevant when you're dealing with children, as there are many techniques which may not be suitable to them. However, FerriScan being a relatively short technique means that most children will be able to tolerate it if they are adequately supported by play specialists or child life specialists. And in my practice, we regularly are able to conduct FerriScans in children who are awake and have not had any form of sedation down to 4 or 5 years of age. Having a technique that is standardized and validated means that you have an accurate result no matter whether the patient is having at different time points the measurement done in different machines, in different places, or even when the technique is being used in the same hospital, even by the same technicians. Just because there is a time span between two measurements, there's going to be different forms of drifts, but which in this case are accounted when you are giving an analysis. And that means that you can generally trust the value that you're being provided. Now, this is very important in clinical practice because if you are relying on the alternative methods of using, which are used for the measurement of iron, like for example doing a regular ferritin blood test or using the MRI T2-STAT technique, you'll very quickly notice that are not reliable in knowing exactly what is the position with your patient, and hence those techniques are used in a way that you can see trends in your patient, so you can see whether the iron load is increasing or reducing. But with FerriScan, you have the certainty that the actual value that you're being provided actually is the truth in the tissue and iron load of that patient. It is important to remember that FerriScan is a technique that is very well tolerated by patients, can be conducted even in very young children with sedation if necessary, and that the results that you're going to obtain are very accurate and reproducible, and hence you can trust them to guide the treatment of your patients and know that the health outcomes are going to be optimal if you target your treatment accurately.